I'm Andy James. I'm on the board of directors of the Foundation for Women and Girls with Blood Disorders, and I'd like to welcome you to our 5th annual Friday Satellite Symposium. Our topic this year is an in-depth look at the emerging science and technology to improve the lives of women with blood disorders. We have a very exciting program today, and I'm delighted that you found your way here. We're getting a little bit of a late start because some people are having a little difficulty. I guess the shuttles were running late, and this room hasn't been the easiest room to find. For that reason, we're going to go ahead and skip our break today. There'll be a continuous break in the next room. Also, until we can get a porta-john set up right outside the door, the closest bathroom is down the hall and to the left. So plan accordingly. Excuse me, down the hall and to the right. Excuse me, down the hall and to the right. We'll keep the refreshments up so that between talks, if you need a break, feel free to help yourself. Of course, the usual guidance, turn your cell phones to mute. I just remembered to do that. And if I do get a call in the middle, it's usually my children asking for money. When you do have questions, if you could save them to the end of the talk. If we have enough time after each session, we'll entertain questions then. If not, we'll have time, I would hope, at the end of either each section or the end of the program to answer questions. Please come to the mic, introduce yourself, say where you're from, and ask your question. This program has been accredited for continuing medical education by Duke CME. I'm the activity director, and you can see our planning committee includes Dr. Donna D. McKelly, who is this year's co-chair of our program, as well as members of our board of directors, and last year's chair, Dr. Barbara Alving. These are the disclosures for our planning committee members. And these are the disclosures for our individual faculty members. And just a word about the Foundation for Women and Girls with Blood Disorders. Our mission is to ensure that all women and adolescent girls with blood disorders are correctly diagnosed and optimally treated. These are our board members, some of whom you know well. As well, we have an extensive medical advisory committee that includes hematologists, both pediatric and adult, who cover the spectrum of benign blood disorders, obstetrician gynecologists, maternal fetal medicine, physicians, pediatric and adolescent gynecologists, family medicine, emergency medicine, internal medicine, pathology, and I'm sure I'm leaving somebody's specialty out. In honor of our 5th annual ASH Symposium, I have just a couple of pictures that Anne Marie Nazaro, our executive director, put in from our first annual, this is actually our launch reception in 2010, where we unveiled our logo. There's Roshni Kulkarni, one of our founding members, and here we are celebrating that event. It had a different name. We've retained our name over the time, but the hotel's name has changed. It was the Peabody then. And this is a picture from our first annual ASH Symposium. It was gynecologic challenges for hematologists, tools for optimal management of women and adolescent girls with blood disorders, and you can see our faculty. And I'd like to say that we have Roshni Kulkarni back this year as a commentator, and Kim Smith-Whitley back this year as a speaker. Thank you, Kim. Between symposia, you can find us on our website, where you can access our Ask the Expert section, access archived webinars, and this program will be archived in 4 to 6 weeks. You can access the website to find out what are upcoming programs. We're not only at ASH, but 4 to 6 times through the year, we are at other medical programs, partnering with other organizations to reach healthcare providers around the issues of women and girls with blood disorders. I'd like to thank you for coming. I'd like to thank our sponsors for making it possible. And I'd like to thank this year's co-chair, Dr. Donna D. McKelly, who over her career as a pediatric hematologist has been a passionate advocate for both children and their mothers, adolescent girls and women. She is currently the Deputy Director of the Division of Blood Diseases and Resources, Division of Blood Diseases and Resources at the Heart, Lung, and Blood Institute at the National Institute of Health. Thank you very much, Donna.